As Pluvicto is a new drug, the monitoring efficacy is becoming more and more important. We have a PSMA-targeted treatment and the use of a PSMA-PET at the beginning to define eligibility criteria. And we can take advantage of that and use a second PET during treatment, usually after 2 or 3 cycles, to assess drug efficacy early during treatment. That's very important to identify non-responders and switch them to a hopefully more efficacious treatment. Until now, the RECIP, which stands for Response Evaluation Criteria, and PSMA imaging is the first standardized criteria developed and has been so far applied and tested on the PET imaging. Now, the SPECT imaging is another imaging type that can be used during lutetium PSMA-617 to monitor efficacy. So the poster and the study behind tested whether the SPECT imaging can be used after 2 cycles of Pluvicto to evaluate drug efficacy, and second, to compare with the PET, and based on the results, to develop a clinical protocol to monitor efficacy during Pluvicto. We found that SPECT is, by using RECIP as a response criteria, is prognostic for overall survival. And second, when we compare with the PET imaging, we found that SPECT alone identified only 10% of non-responders after 2 cycles of treatment, compared to PET that identify more patients. However, when we combine the SPECT imaging by RECIP with the PSA and compare it to the PET plus PSA, we did not find a significant difference. So that was very encouraging, since in our practice we use both imaging by SPECT or PET combined with the PSA to monitor efficacy. So that was very encouraging to see that we can use either SPECT plus PSA or PET plus PSA to monitor efficacy. This is really important for our patients, since PET comes with some challenges. For logistics, we do not have enough PET scanners to cover for all the requests and get them timely manner, the scans after 2 cycles. And second, the patient needs to receive a second radiopharmaceutical injection for the PET imaging. For the SPECT, we can use the radiopharmaceutical injected for the lutetium PSMA-617 treatment itself. And our results show that we could confidently use SPECT alone for monitoring treatment efficacy during Pluvicto, and PET may not be necessary if not available.